Exploring Mental Health Access for Deaf and Hard of Hearing Communities by Tracy Baker
and Rebecca Zahn.
Between 15 and 26% of people worldwide are affected by hearing loss, with 7 in 10,000 being users of sign language. Signing deaf community numbers range between 6,500 and 15,400. Lip reading isn't perfect either. Deaf adults on average can lip read only 26 to 40%. By removing barriers, we clear the way to allow people to maintain their independence, to continue to be in control of their own actions and their own lives. The diagram displays equality, equity, and justice, thanks to no barriers. People with hearing loss encounter practical and social problems beyond those experienced by hearing people. This increases the risk of those with hearing loss developing mental health problems. For deaf and hard of hearing people, practical and social problems can lead to poor mental health. It doesn't take much for these feelings to become overwhelming, and by then, counselling and other types of therapy are paramount to recovery. Wouldn't it be nice to think that deaf and hard of hearing people could be given the same level of opportunity to recover from these basic human emotions? With that in mind, let's look at some services that can help in this way. A major barrier to accessing mental health services is that those offered to the deaf and hard of hearing community are limited. However, we found 4 which offer counselling services to deaf people by both deaf and hearing counsellors. Of the 4 services, 2 are in America, 1 is in Australia, and 1 in the UK. Deaf Counselling Centre in America was established in 2001 and began because the founders believed that traditional therapeutic models developed by hearing people were ineffective and inappropriate for people in the deaf community. The Carley Centre in Blackburn, Victoria also offers deaf counselling and deaf clinical psychology, along with group therapy, retreats, and other health and wellbeing services and classes. Counselling services are offered in either AUSLAN or spoken English. Carly Detman is the Centre Director and offers clients access to multidiscipline support and care for clients' mental health. The Centre also provides information for professionals ranging from deafness to communication barriers. Two services work in conjunction with the Carley Health Centre in Victoria. These are Stop Deaf Suicide and Signpedia. Deaf for Deaf acknowledges common problems with accessing counselling for deaf and hard of hearing, those being communication difficulties with using deaf language and having an oral counsellor, an issue with the hearing counsellor having no experience of the deaf culture, and interpreted counselling, so needing to be involved in a 3-way conversation. The National Suicide Prevention Lifeline offers support to deaf and hard of hearing people via teletypewriter and chat assistance. This service is a calling centre based solely in the United States. It allows people of all circumstances, both hearing plus deaf and hard of hearing, to privately discuss mental health experiences. Australia has also got the Lifeline Calling Centre. However, it is not currently in support of deaf and hard of hearing people. There are a wide range of services present in the state of Queensland. Deaf Services is a Queensland-based not-for-profit organisation offering support services to deaf and hard of hearing community in many ways, including deafness and mental health workshops and Are You OK Day activities. Community connection has been proven to improve mental health. The Deaf Can Do service offers NDIS planning and crisis support, as well as AUSLAN and English interpreting services, and help with overcoming day-to-day barriers. Robert Knock is a child of deaf adults and provides fundamental counselling and interpreting services through private sessions, which according to our research is lacking elsewhere in Australia. The Indigenous film Be Strong is produced in AUSLAN with open captions and is an important resource for health professionals to use as an educational tool. It identifies the main areas of wellbeing and definitions for common mental health conditions such as anxiety, depression, and schizophrenia. The Australian Government has acknowledged there is a need for further support of the deaf and hard of hearing community. In February 2019, it set out a roadmap for future improvements of communication in the professional workforce.
For more information on any of the slides, a list of references has been provided. The Be Strong video plays for a considerable amount of time and is accessible via the Metro South link. Please feel free to like this video. Thank you.
Thank you.